Ellume USA, and we're proud to make it in Maryland.
Welcome to our Make It in Maryland Manufacturer Spotlight Series. Today we are really excited to be out in Frederick, Maryland at Ellume Manufacturing. And I'm joined by the team from Ellume. Why don't you guys take a minute to introduce yourself?
Hi everyone, this is Alicia Jones, VP of HR for Ellume USA.
My name's Dan Mallon. I'm Vice President of Business Development for Ellume USA.
Beau Bryant, GM of Operations for Ellume USA.
Alicia, Beau, doesn't matter who. Tell us a little bit about Ellume and the Ellume story.
Sure. Ellume was founded in Australia, Brisbane, Australia in 2010. Our founder and CEO, Dr. Sean Parsons, was an emergency physician, and he realized during the swine flu that if he could improve the diagnostic solutions to break community transmission, he could save a lot of lives. And so out of that, a company was born that could provide digital diagnostics to help break that transmission. And really, he's created a company that is able to take the convergence of both diagnostics and the consumerization of healthcare and create products that help get to optimal therapy. So really exciting time. Ellume transitioned over to the US in the course of the last 2 years, and we've been hard at work to expand the production facility here in the US.
So let's talk about that for a minute. You guys are an Australian company, decided to lay down roots in the US. You've been at it here in Frederick for just under 2 years, from start to finish, and in the building maybe a little bit over a year. Mm-hmm. How has that been to build a modern production manufacturing company from the ground up?
It's been difficult. So it's been a really aggressive approach to ramping into manufacturing. We knew that the community and the country had a need, and we wanted to respond to that need. So obviously our ties with the US government, general retail requirements and that type of thing, we moved into production very quickly and moved into scale quickly as well.
And it's quite an incredible journey when you think about going from a concrete slab to production in less than a year. And that was everything from the facility to the people. And a lot of that is credit to the support we had from the government, the state, our local government. And it's an incredible accomplishment by the team.
And I'll just add that it's been both sides of the globe. So Australian team has delivered products from their manufacturing facility and really established that process in Australia. And that's what's been tech transferred here to the US at a larger scale, beyond what's in Australia. So both countries have benefited in terms of having the capability in both locations.
And Alicia, I think you just hit on going from the dirt ground to production in 18 months or so. I think you guys are even selling yourselves short. You have one of the most modern, beautiful manufacturing facilities, and you all are combining manual manufacturing processes, and you're learning while you're building, and now you've got fully automated robotic lines out there. How has that been a part of the planning and a part of the implementation of what you guys are doing out here?
I think a big part of that, and Alicia mentioned it a minute ago, the teamwork between not just production, but production, engineering, training, HR, quality, everyone really coming together with that common goal of get the facility up and running, start to produce products, and really focusing on that has helped us keep everyone pointed in the same direction and moving forward. The need to build out the manual process swiftly was able to be done because we had some of that knowledge from Australia, while in the background knowing that we needed to produce on the automated lines and get those up to scale was all happening at the same time. And while difficult, we were all always focused on that common goal.
Yeah, I would just add, part of the product development side of this is that we have a very human-centric design on our products that are fit for consumers and also healthcare practitioners. And that plays into the automation of the manufacturing facility as well. We wanted to create products that were able to be put onto flexible, modular manufacturing systems. And so it starts with that concept around how we build the products, and then it becomes a design requirement in terms of how we take that manufacturing process and really go from manual to automation. And so that's going to enable us for future products to be able to take other disease states, to take other platforms, and leverage that same automation and that approach that we took for the COVID product and apply it to those new products as we develop them.
Great. And Alicia, you live in the HR world, and you've been tasked with probably one of the most challenging jobs, which is, hey, we've got this new building, we turn the lights on, now fill it with workers. How has that been for Ellume, just starting up and ramping up to, well, I don't know, what's your total head count now?
Yeah, we're at 150 people now for this facility, and it was a journey for sure. And again, as Beau mentioned, it's all about the teamwork. It's about having everyone aligned with their goal. There's a lot of passion. Our culture is fantastic here. People are really engaged. Having such a meaningful product in the market translates into the culture as well. Human-centric product, human-centric culture. And you can see that just even from the building design. Very open, modern, windows, a lot of natural light, and the teams really are bonded. It's more a community than anything, and that's how we were able to scale up in the way that we were.
I love the human-centric theme. I love the teamwork side. When we were out walking the floor, I met a gentleman who came to you all from Panera, and I met someone who came from the IT world, and I met a girl who's fresh out of college. Talk to me about the skill set that's needed to work at Ellume and the team that you all have assembled out there.
Yeah, and I'll certainly let my colleagues also weigh in on this, but for us, it's about having the right mindset. It's about people that come here that are team-oriented, they want to work, they have a strong passion for making that difference in the world and in the community, knowing what is going on and how the pandemic has personally affected many of our employees. Everyone has a story of how it has touched their lives. So they come in here passionate about being able to make that contribution. And we're fortunate and lucky to have the knowledge and the skill set in the teams to be able to support them through some pretty robust training plans and being able to upskill them as well and help them grow and expand their own careers.
I guess I'll just add to that as well that our training program was pretty robust. We trained everyone, so supervisors, team leaders, and everyone was coming through. We also cross-trained between not just production teams, but also warehouse teams and QC teams. So they had an understanding of what was going on the other side of the fence. And again, that really helped bring the team together so that people could understand what was going on each side. But doing all that very quickly and also assessing that training and how well it's gone was really a big part of building the culture and building the group so that they knew that they'd go into manufacturing together.
Talk to me a little bit about that, about the culture of Ellume and what you all are trying to build here. Right, we're in a really competitive environment from a worker standpoint. You all are in a competitive market from the medical device, biological, pharma standpoint. There's lots of competitors here, but yet Ellume stands out, and it's one of the companies that we hear about. What are you all doing to create that culture?
So the first thing for us is it's about setting up a community. It's about having a community of people, the community they're attached to their surrounding communities and each other, as Beau mentioned. It's all about the teamwork piece. With that, we have seen a lot of amazing things, and one of the things that's a driving force for us is that the culture is not driven by HR, and it is not driven by management. It's actually driven by the people themselves. So we really engage them in the process of building the place that they want to work at and how they want to do it. And you see it every day when you walk down the halls, when you see a particular team wearing all their Hawaiian shirts together on the same day. We talked about the headquarters being in Australia, and we've traded our cultures. We've opened up and shared that. We've traded our Old Bay for their Vegemite and really expanded that within the teams. And you see it because people are connecting personally. You see them that they're connecting outside of work with their own hobbies and passions and things that they do together. So it's quite amazing to see the community flourish because we've empowered the people to build the place they want to work at.
And I think that all can happen because the employees that come here, back to what you said earlier, are committed. They're committed to the products that we're building that can support public health and can really make a difference in terms of not only their families' lives, but also their community and beyond. So I think that allows the employees to do that.
We do have a diverse amount of people coming in, though. Like you said, there's people fresh out of university, there's people from food and beverage, there's people from medical device or pharma, and bringing them into a common place work environment has been, it's had some challenges, but in order to overcome that, we've set a lot of structure in place so that people who had manufacturing knowledge before are used to seeing a production team board and regular meetings that happen through the day, and people who aren't used to that can easily adopt that sort of culture and that understanding about what we're trying to produce while we're looking at the daily, hourly numbers, and really get that culture and understanding through the whole group.
Yeah, the Ellume leadership team wants to set up the environment to allow people to flourish and then support them when they do.
Now, before Alicia goes crazy and gets rid of our Old Bay,
Oh,
have you tried Old Bay flavored Vegemite yet?
I have
And is
not.
that something
Oh,
we
wait a
can
minute.
market in Australia? I think we're on to something.
New
We might
product
be able
idea.
to. It's we've had a hard time selling Vegemite.
Sprinkle some Old Bay on it, and Marylanders
Good
will
Old
eat
Bay,
it.
that's
Yeah.
the key.
That's right.
Yeah,
That's
yeah.
good.
Old Bay and Ranch have been popular.
Yes, they have.
So Dan or Beau, maybe you guys can talk a little bit. We're coming up on 3 years from COVID.
Yeah.
Everybody has taken more COVID tests than they probably would like to or know or remember. What sets Ellume apart and your test? You guys are doing some unique things and have some real differences with some of your competitors. What sets Ellume apart?
Yeah, it's a great question. So I think mentioning kind of that human-centric design is really important. And so we found our test is one of the most accessible tests out there in the market, which from a health equity standpoint is really important to Ellume, and it's very important to this current U.S. government administration as well. So we really struck a chord with the National Federation of the Blind, the American Printing House, because our test as an antigen test is one of the most accessible. So that's an important design feature, and it was really designed to be the most easy to use. The digital features that we do have with the app allows for clear results to be presented to the users. We've got digital reporting that's automatically uploaded to the cloud to be made available to the individual taking the test or to their work, school, doctor. And we have just the capability to leverage that same home platform both at the point of care, so it can be in physicians' offices, or else at home, and it really has allowed for that flexibility of those results to be shared kind of very diversely.
Anything to add to that, Beau?
No, that's exactly what it is.
So obviously COVID is something that's here to stay, but it ebbs and flows. What's next for Ellume? What's on the horizon? We've got this amazing manufacturing facility and space to grow. What's next?
Well, I think the company was launched with the focus in mind in terms of the unique technology. So the optical reading and the fluorescent digital technology is the first one that actually has been provided over the counter. And so we're looking to leverage that in not only future disease states that could be pandemics as well, and so we have close relationships with the government. But from a consumer standpoint, we're looking to take the work we've done on COVID, and we've initially had done a lot of work with influenza. And so we're focused on providing a COVID plus influenza test. RSV is another area in the pediatric population we think has a lot of opportunities. So we'll continue to produce and innovate based on that platform technology for different disease states. And in addition to that, I think we're going to have a diverse pipeline of formats to present. So the digital solution is very good, as I mentioned, for an accessibility standpoint. But there's also lower cost solutions that we have been working on and developing that may not need the digital reporting capability, or could potentially be lower cost if you are doing serial testing over the course of, through your family. So we're looking at all segments of the market and making sure that we can leverage the manufacturing capacity and capability to ensure that we're able to meet the needs of all consumers across that diverse portfolio.
Great.
Sorry, I'll just add to that, our manufacturing facility as well. I mean, the way we've designed our production areas and rooms, the equipment, the manual processes and the automated processes, they're very flexible. So as we move forward, we've designed our automated lines for what we feel is the most complex style of diagnostic test that we would ever need to build. If we wanted to adapt that to subtract particular features or not use the Bluetooth capability, we would use the same machines and just reconfigure them.
And from a production standpoint, Beau, you guys have gone from manual. You now have some automated processes. You and I talked about, integrating some of those other functions that are currently outsourced, but bringing them back in-house, packaging or some of the logistics side, and how you're vertically integrated on the other side of the product. So what else are you looking at from that standpoint?
So yeah, definitely bringing packaging in-house. We currently procure many items that we could produce in-house. Some of the reason for not producing them in-house is really just the rate that we scaled. We knew that we would produce our analyzer and dropper straight away, so we focused on that. As we move down the track, we'll look to bring the other components of our device in-house.
Great.
Yeah.
And Alicia, how about for the future of the workforce here?
Yeah. We are always looking ahead on our people and how we help them grow and develop. And our philosophy here is not about a specific skill set. It's about the ability to learn and having a learning organization. So we heavily invest on supporting that side of things, the training and development for people. So whatever tomorrow brings, we'll be prepared for.
Awesome.
Yeah. I mean, I think the capability that we've built here,
Yeah.
both from a production equipment and workforce standpoint, bodes well for us to be responsive, again, to the next kind of pandemic that's out there. So assay development capability, being able to be responsive to any kind of threat that comes up. Our digital reporting capability allows for early reporting, and that's so crucial in the public health kind of arena to know where a potential disease is kind of spreading. So that capability is going to be able to be leveraged from a pandemic standpoint. But on the commercial side, just from a consumer and healthcare standpoint, we also have built a team of people, and partnerships are going to be crucial for that, to commercialize these both in retail pharmacies and further distribution through different points where people are going to access their healthcare. So I think that kind of democratization, as I mentioned earlier, is really going to be crucial for the digital diagnostic technology that Ellume is creating here.
Great. All right, for the group, what's a fun fact or something that you want people to know about Ellume?
Ooh, that's a good one.
I would say that we have a lot of fun here. As I mentioned about between the shirts to the Old Bay to once there was maybe a flash mob in the middle of a meeting. And we like to have a lot of fun here. So it is a fun work environment, friendly, very much a community.
What song were they flash mobbing?
I don't remember. I wish I could remember that.
We'll have to ask Juanquina.
Now I'm gonna have to go back.
Yeah.
Yeah, it was Juanquina and Jen, and yeah, it was
Yeah.
the people team, of course, led that effort.
Yeah.
Beau, how about you?
We try to, we talk about blending the cultures, and
Yeah.
we did
That's
get
what I
a
was
good
gonna
group of Australians here,
Yeah.
which was great, myself included. It's been a huge learning for us coming from Australia, and even I've visited here before in the past for vacation, and living and working here has been really completely different. We celebrated Australia Day earlier this year, which was good. We again had a difficult time selling Vegemite to everyone, but the two cultures coming together, while very similar, it's been a really good adventure getting the two cultures to come together.
You
And I
have
would-
taught us a lot of slang. Tickety boo.
Yeah.
That's my favorite. Everything's all tickety boo.
Yeah, a lot of fortnights.
Yeah.
Fortnightly. I would also just say that Frederick, the city of Frederick, and the community in Frederick has been fantastic. So
Amazing.
we've learned a lot from the Australian folks that have come over here, but I think Frederick has been welcoming and warm, and have really kind of helped that transition for a lot of the secondees from Australia, but also folks that have just joined the company and seeing that Frederick is really booming. And there's a lot to offer here in terms of a community to live in. So I think that's been actually a really important point for Ellume as we've established our foundation here.